So, NUR203 Exam 1. This is the PowerPoint that is done. Honestly, I'm the one who makes these. I'm the one who goes through the concepts, making sure that what you need is here. So, any questions, let me know. So, one of the things that you're going to see, and really pretty heavy, about 7 questions, is going to be on your theorists. So I'm going to try to make it in a way that you can understand and will be able to choose from the choices or understand it better. So Erickson. Erickson talks about psychosocial, which means how does that child or person relate to people around them? So, an infant, do they relate to the people around them? Oh, heck yes. I'm hungry, I cry. Somebody comes, feeds me, changes me, burps me, and puts me to sleep. I have a sense of trust, security, because all my needs were met. Now, mistrust. This could be in a situation of homelessness, drug abuse, alcohol abuse, something that the baby is not being picked up. The babies ignore when they cry. Not one time, but most of the time, okay? Then they feel a sense of mistrust. Actually, these babies almost stop crying because they know nobody's getting them, so why try? Now, Erickson and toddlers. Well, what do we know about toddlers? Oh, toddlers are all about me, mine, I do. I'm not sharing. Automatically mine, autonomy. Okay. Mine, me, I want to do it. So they want to be independent. They want to try things. But there's a problem, the shame and doubt. And you can accuse me too. I'm that grandmother who's the helicopter, who's making sure my grandchildren aren't going to fall, aren't going to hurt themselves, help them get dressed, put their shoes on. But that leads to shame and doubt. Like, why are you doing that? I should be able to do that myself. I want to do it myself. So, Erickson, toddler, automatically me, mine, autonomy, and helicopter Nana, shame and doubt. Shame on you for doing that to that child. Let them learn. Now, when we get to preschooler, it's initiative versus guilt. Initiative is they want to do things, they like to help, they like to make decisions, but it's not always correct. That's what Erickson is right there. Now, I think the most difficult to understand is school age, and you're going to be tested. School age, adolescence, and your infants always tested, whether exam, whether your quiz, whether on your HESI. I know the NCLEX has these on there too. So, school age. What do we know about school age children? Well, there are things school age children do well. That is their industry. Well, let's take the word industry is a factory, it's a product, it's something they produce and do well. Okay. Now, that makes them feel good. People praise them. They comment, oh my goodness, you're the fastest runner. I don't believe you spelt that word. Oh, you know that math problem already? Wow, you're so good. That is industry. I feel good, pride, accomplishment. I feel great. Well, I can't do everything well. And that's the inferiority. I want to do everything well and feel as good as I do when I'm spelling or running or, doing math problems, because I do those really well. Okay. Now, when we get to people and how they respond to their environment as an adolescent, what are adolescents looking for in other people? Well, they're looking for their identity. Who am I? Where do I fit in? Am I the drama group, the band group, the art club? I mean, who am I? Let me fit in there. And then it's role confusion. What am I going to be when I grow up? Am I going to college? Am I going to trade school? Am I going to be a doctor? Am I going to be a nail technician? What am I going to be? So those are Erickson's, all right? Most tested of all the theorists right there. Freud. Freud is anything sexual. We have oral, infants explore the world in their mouths and they soothe themselves. So when they're stressed, put a pacifier. in their mouth and they can calm themselves down. And we know children are everything in the mouth all the time. It's just what they do. Anal stage is toddler. Well, what do we do in toddlers? We start the potty training. Remember, bowel is trained before bladder. So focus on the bowel training first, okay? When we get into the preschoolers, it's the phallic stage. And it's because they're starting to know the boys like the mothers and the girls like their daddies. And they're starting to see the differences in all of the sexes there. And it's just the phallic stage, okay? Now, again, school age and a weird name, latency. All of that means is they want to hang out with their same-sex peers. They're starting to talk about family life and culture and things, and they're starting, and it's non-threatening with a same-sex peer. And that's what Freud says. By the time we get to adolescence, now we're starting to get the hormones kicking in, right? That's the genital age. And they're starting to be attracted, not necessarily to the opposite sex or whatever sex they're interested in. They're starting to get interested in sexual type activity and they're excited by that. Now, Kohlberg. You don't really have to know the pre-conventional, conventional, post-conventional. What I want you to know with Kohlberg is infants and toddlers don't understand right and wrong yet. They just don't. That's their exploration time. By the time they get to preschoolers, 3 to 6, 3 to 5, 3 to 7, the years don't matter, just it's preschoolers. What they understand is if I do something wrong, I'm going to be punished. And if I do something good, I'm going to be rewarded. So, good or bad, there's a consequence for each. Okay. That's what they understand. As we get older, Kohlberg says school age children, they love to please, they like to conform to rules, they don't want to be in trouble. And that is your school age. Now, when we get to be adolescents, it's just not hanging around and pleasing. It's the rules of society. Stop at the stop sign. You're going to open the door, a man for a woman. You're not going to smoke in restaurants. These are rules you cannot break. That's what that means, rules by society. And that's because now they're thinking, right? Formal operations thinking. I put in a religious theorist here. You don't necessarily have to know it's Fowler's, but in religion, this can be really tricky because you have different people, different cultures, and you don't have to know everything about everybody's religion or beliefs. What you need to do is to be able to incorporate what that patient, that family wants to put into their care as long as it doesn't affect your nursing, okay? As a nurse, you don't have to believe, agree, anything, the other religion. You just need to know who your spirituality is. So examine yourself. That's the important thing. I don't have to understand your religion. I just have to understand me. So Piaget is talking about cognitive thinking. So initially, we know that Piaget says we did that reflex grasp and we grabbed that rattle. And eventually they grabbed it without even trying to do it. All of a sudden, they move it and there's a noise and they go, oh, I like that. So first we grasp it was a reflex. Now we're going to grasp it. It's voluntary. We moved it. It's making noise. We're putting it in our mouth now. Oh, that feels good. Oh, I like it there too. So we build upon certain things initially for the first up to 2 years. It's building upon little schemas. So we started with the rattle, then we shook it, then we put it in our mouth. It's like you have to start at the very basic of learning and then you build upon it and make it more and more and more. Now, as we get older, preschoolers, they're starting to do what we call pretend play, taking blocks, making them into cars, taking a broom, making them into horses. And again, now this is now magical thinking. As Piaget gets into school age children, this is where they start with what we call concrete operational. So let's take the word concrete. It's hard. You can touch it, you can feel it, you can smell it. Operational, which means I've seen that operate before. I've heard that before. I can replicate it. They have to see it in order to do it. Now, adolescents, they don't have to be shown a darn thing. They know what they need to do in order to get what they want. As a single parent of two teenagers, a boy and a girl, that's 17 months apart, so it was pretty rough. And these children knew what to say, what to do in order to get what they wanted. It was all right. They made their bed, they took the garbage out, they made dinner for me, coffee was given to me in the morning. I mean, they do all this stuff to get what they want when they're punished. And that's adolescence. Nobody taught them that. They figured it out. That's formal. So these are basically looking at all the different things. We start at, first of all, we suck our finger and then we start moving it around. And now we're making all sorts of fun with it and magical thinking. And these are more and more about them. You can look at them more. There's just different ways of viewing at it. Play. Play is extremely important. There are different sorts of play, and it's according to age. So when we're infants and we're toddlers, basically, infants just play by themselves with their toys, so it's a solitary play, all right? But onlooker is more of that type of looking at somebody playing. Now, toddlers, me, mine, don't share, right? They can play next to another child, parallel to them. Two or more kids can be there, but they're not sharing a darn thing. They're not talking, they're not sharing. That's me, mine, toys, leave it alone. Okay. That is absolutely normal for toddlers. As we get to preschools, now we decided, hey, playing with the other kids isn't bad. So now it's two or more children all playing together, but they don't create anything. There's no goal. It's not like checkers and they win the game, or they finish building the racetrack so they can race cars. No, it's none of that. But they're working together, playing, just being creative. Now, cooperative. This is more your school age children. This is two or more children playing together, but there is a goal. They're creating something. They're creating a racetrack, building a sandcastle, or they're playing checkers or dominoes and somebody wins. That is the thing. There is a goal. Cultural differences. Big thing that I got hit with when I moved to Miami from a little small town in New York. We didn't have a lot of culture, and I come to Miami and I have it all over the place. I had no clue what the culture was, what the differences were, and I had to ask a lot of questions. So, what I have found with cultural differences, you don't have to know everybody, everything, and what they like or don't like. No, that's not your responsibility. Your responsibility is to ask questions, whether it's an older child, maybe a young teenager, or the parent or guardian caregiver. Say, is there any differences in food or any things that you would like? I don't understand about your religion. Is there anything I should know, et cetera, et cetera? I find when you ask questions, they are going to tell you, and you're respected more because you're respecting their differences. And again, you don't have to believe in them. Only first examine yourself. You know who you are. They can practice what they want. Again, as long as it doesn't interfere with medical care. Now, doing assessments on a child depends on the age. First of all, the young kids, they look at us. All we do is give needles and shots and hurt them all the time from the moment they're born. This is what nurses do. So they don't really like us. So get down on the same level first, okay? And then remember, from least to most intrusive. I consider that as I'm not doing a blood pressure to the end. That big squeeze, those kids do not like. So again, play with that child, make it into play, make it fun, make it less threatening to them. And again, always from least to most intrusive. Now, when you're taking a history from any parent, Always be sure to listen, especially with injuries. What did the child say happened? What did the mother say? Is there a difference in the injury and the story that was said? It doesn't make sense, okay? It's your responsibility to keep children safe. The other type of thing that we see with children is something called Munchausen syndrome. And this is a caregiver who likes to keep the child ill, likes the attention of that. They can take toilet water and put it in the IV, or take dirt and put it in wounds, and or they can give them chemicals in foods they bring. All sorts of things can happen. What is our responsibility as a registered nurse? Well, again, it's to protect the child, right? So when that person suspected comes to that child in the room, one of the staff members must be in that room at all times. Also, anything brought into the hospital must be inspected. Now, you don't have to have somebody in there all the time. The kid's a normal child. It's when the parent, the guardian, the caregiver comes in, you have to be concerned and you need to monitor that. So when that parent comes in, then they need monitored. It's not like 24-hour type thing. Growth at any age. Well, nutrition, 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 nutrition. If a child doesn't fill the tank with gas, they're not going to grow. And cognitively, you're not feeding the brain. They're not going to develop the way that they should. So it's the single most important influence on growth and development. Infants should double their weight at 6 months, triple their weight at 1 year. Weigh in more or less than you expected, you need to figure out why. If a baby at 6 months, born at 7 pounds, weighs 9 pounds at 6 months, there's a problem. They're not filling the tank up with the nutrition. Therefore, they're smaller and probably cognitively at 6 months, they're not rolling over. They're not lifting their head. They're not grasping. And these are things why we need to know growth and development to see is the nutrition matching growth and development also. Now, as a kid gets older, we'll see two children that are overweight, underweight. How do we measure nutrition in children? Well, it's the height and weight that we do there, right? We find out there's a discrepancy of what we think it should be. What's the next thing we do? Well, immediately, it's that diary. What did you eat for breakfast? What did you eat yesterday? Give me a diary. You'll always see the answer when it comes to weight will always be about starting a food diary. Now, again, food diary and looking at nutrition, there's something BMI. No, you don't need to know this whole formula. What you need to know, BMI measures how heavy you are, or if you're at risk for overweight or being obese. If you are in the 85 percentile, you're overweight. But when you get to the point, and then you're at risk, they call it at risk. At 95%, you're obese. You are overweight. And again, how do we look at nutrition? Any age child, let's get that food diary. So developmental assessments are done because we want to make sure a child is where they need to be. If they're not rolling over and they're 10 months old, there's a problem. So we need to go back and investigate it. What is so beautiful about children? If we are seeing deficiencies in developmental progression, we can do early intervention, whether it's speech therapy for the children not speaking, physical occupational therapy for those children not moving, standing, walking, rolling, crawling the way that they should. And that's why we do it. We will find out if there's a physiological reason, a nutritional reason, and we'll correct it and get that kid back up to where they need to be. Now, assessing children, assessing their heart, assessing their lungs, especially on an infant. So a heart rate on an infant, now neonate is the first 28 days. That's the 140 to 160, okay? Infants up to 1 year old, and they say the heart rate is 110 to 160, absolutely normal. These are the heart rates that you're going to probably see more questions regarding. Is it a normal heart rate? Is it not? Well, if it's 110 to 160 the first year of life, that's absolutely normal. If it's 90, it's too low. If it's 200, it's too high. Just simple as that. Now, I put in here where the all the valves are in the heart, and yes, you can go through and listen to them with a heart, but with especially an infant, those infants when they're awake tend to coo and move and and they're moving and you're wiggling and it's very difficult to listen to heart and breath sounds. Know that a sleeping baby in the arms of a mother is the perfect time for a nurse to listen to breath and heart sounds because they're quiet and they're comfortable. Remember, from least to most intrusive, and a sleeping baby is probably the best assessment of lungs and the heart. All right. Now, remember, children, they have what we called referred breath sounds. So there's a way to listen up above, so upper airway and lower airway. And this is basically what this is talking about here. Car seats. Car seats are for any child, and even booster seats are up to age 8. With the car seats, they need to be rear facing in the rear seat. They actually say in the middle of the rear seat until they're 2 years old or 30 pounds. Now, when you are using these car seats, make sure that those safety straps are snug. And the other thing is, smaller kids, they don't fill up the whole car seat. Use blanket rolls and sort of hold them into position. And that really, really helps. Okay. Know that old car seats, they do retire and they're not as safe. The funny thing is, I remember that metal box up there. I remember my brother sitting in it. And the funny thing, it was in the front seat. That's a few years ago. So, infant, let's look at some things we need to know. Growth and development. Some of the things that we could see or things that should be doing. Now, what is head lag? Head lag is when they're on their back, you hold their arms, you pull them up, and their head falls back. It should come up with them about at 2, 3 months. If it's still falling back at 6, 7 months, there's a problem. SIDS death. SIDS is the first 1 year of life, birth to one. That is the incidence of SIDS that we look at. Children, infants, should be only on their backs to sleep or take naps. They should be able to go from their abdomen to their back about 5 months, back to abdomen about 6 months, as in rolling over. That's a safety issue. When they're on their backs, they put their feet in their mouth and chew on them. They think it's pretty cool. They're grasping objects about 3 months and exploring the world in their mouth. Everything is their fingers, their whole hands, whatever, in the mouth. Teeth usually come up about 6 months. It doesn't mean all kids can, but that could be the beginning, the first one you might see. One of the questions you see a lot, sitting unsupported by 8 months. And then when they're about 12 months old, they are attempting or they're taking steps. Colic. I think this is a curse for those parents who have a baby with colic. This is a baby has so much gas and crying and there's nothing you can do. Usually about 3 to 4 months of age, it goes away. They do everything to help these children, burping and changing formulas and adding antacids and nothing helps. Very difficult to work with. Now, if a parent calls in, let's say you're at a doctor's office or in an ER urgent care, parent calls in, my baby, my infant is, 2 months old and there's crying and crying and I can't stop it. What do I do? Don't ever assume it's colic, all right? Have them come in to be seen. Remember, infants 3 months and under are severely immunosuppressed, and they do need to be checked out to make sure it's nothing more serious. So developmental periods. Let's talk about sequential, developmental, and sensitive periods. Sequential means we lift our head and we turn over and we crawl, we creep, and we walk. That means the forward progression of it. Developmental things also has to do with doing that, but also fine motor skills are also in there too. And then sensitive periods are the period of time where that child does great strides, where, they are not talking and all of a sudden they're talking forward sentences. They're not rolling over and now they're up on their knees and they're rocking themselves. It's what they call the sensitive period, where they really do some big things at that point. Now, the soft spot, fontanelle on a baby. What's neat about fontanelles, it's a great assessment tool. You can see fluid balance so easy with that little fontanelle up there. Now, posterior in the back of their head, it's gone about 2 to 4 months. Usually it's gone before you even feel it, and it's usually quite small. The one on top is the anterior fontanelle. That should remain open till about 1.5 years. If it's 2 years old and it's still open, that's a problem. Why is it open? Is there a brain tumor that's expanding the skull? Is there hydrocephalus expanding the skull? Something that will need to be investigated. So posterior closes by 4 months and anterior by 1.5 years old. Pain in children and infants. So infants, what do you see? Well, they're not going to say, hey, I have pain. So you're going to have to look at that child and you're going to have to figure out. So if they're crying, grimacing, that little chin going as they cry, oh, that really gets me. Their eyes get tightly closed and their limbs are up and down and they're thrashing and you can hear them. You know that they do hurt. Know that infants just need acetaminophen or an ibuprofen or morphine. Remember, there's other things that we can do. Give them a pacifier, elevate their head of their bed, rock them. Another thing to help a child with pain is that pacifier, right? A little sugar water. We use that a lot, putting in IVs and lab draws and doing catheterizations, and they just suck on that pacifier, and I'm telling you, it's like they hardly had any pain at all, okay? Know that infants, great thing is that oral sucrose with the pacifier. You can do that for anything. SIDS death, like I said, is the first 1 year of life. What are the increased incidents and what would you see? Well, any infant who's put to bed on their bellies or sides can have an increased incidence of SIDS. So it is recommended back to sleep. The program where I worked at a hospital was all about back to sleep. Back to sleep is what the program. So we don't put them on their bellies anymore. And we do see a decrease in SIDS. There's no more of those pretty bumper pads that I had with my kids because they get tied up and they choke themselves. The rails are smaller and not so wide apart, so kids' heads don't get stuck. There's so many things that they're doing different today. Babies should not be in the bed with their parents. I've actually seen one father who was a larger father rolled over on his baby in the middle of the night and suffocated him. It happens, okay? So I would highly recommend never have the baby in the bed with you. Overheating the baby. We think that they're going to get cold. Putting too much clothes, too many blankets, that's not good. Of course, prenatal care is always important. And then a recent viral illness. Why would that be? Well, infants, what do? They suck, they swallow, they breathe. Put some mucus in their nose, and they're obligatory nose breathers. Now they're not breathing well. That's why SIDS death increases with the recent viral infections. Young mommies, premature babies, and males more than females. Now, infants do have reflexes. I think a couple of them that you should know is when you take and you do the little side of their face, and this is called a rooting reflex. When you do this, the baby's going to turn to look for milk or breast. Startle or moro is when a loud noise or you hit the bed and their hands and their feet come up, and that's the startle or the moro. We've already talked about the grasp reflex. It starts out with reflex and then it also then goes into voluntary and Babinski, same as adults. And yes, they always have Babinski. The other ones go away about 9 months. Another thing infants do is something called a parachute reflex. Take a child who's between 6 to 9 months, turn them on their tummies, and put them like you're going down on the floor. They'll put their hands and their feet out. This is good in case that they fall. This is what they do. They protect their heads. All right. This is absolutely normal. Nutrition, infants, first 6 months, only iron fortified formula or breast milk. If they're doing breast milk, remember they need a vitamin D oral supplementation, has to do with muscle and bone strength, that they do need that. Now, when a baby's breastfed, this is the time where the mother goes, I don't know if they had enough and think they should give that baby a bottle. I don't know if they sucked enough. I don't know if they get enough. Well, what do we tell these parents? As long as the baby has 6 to 8 wet diapers per day, they're good. And we know that usually 2 weeks after the baby's delivered, they're brought to the doctor's office for a checkup. At birth, they're going to lose 10% of their birth weight. So we get a birth weight, a weight right before they're discharged home. Then we bring them in 2 weeks and we weigh them again. They should be back to birth weight by then. And that's why we do that, okay? The second 6 months, now we're starting to introduce food. They're drinking a lot of milk now, especially if they're breastfed. Mommy needs a little bit of a break. We need to start introducing food. Remember, with nutrition, with food, food's first, milk is second. We want them to get as much as the food that we can in there. One food at a time, and wait 4 to 7 days before introducing another food. And as we're feeding them, know that children can get allergies to all different sort of foods. It could be anything, okay? So check for the rash, check for anaphylaxis could happen. Sometimes it's just a diaper rash, vomiting, diarrhea, abdominal cramping, gas, these things, all of those things could be happening. Another thing with parents, as you're starting to feed these children, the stool is going to have some food in it. I mean, think about all of you. When you eat corn, don't you still see it in your stool? So you can see GI doesn't digest everything. Now take it and put it into a 6, 7 month old little infant with an immature GI tract. Now you can see maybe the little green beans and little peas and a little bit of whatever in there that they're eating. Absolutely normal, okay? Now, as we get up to 12 months old and we're going to start to wean from breast or bottle, we can introduce whole milk. Now, not every parent wants to wean, personal choice, it's okay, but what you need to know is when we start feeding them milk, it is whole milk and it's at 12 months. And it's whole milk because they need the fat for their brain, okay? Another thing that we start doing at 6 months is soy-based yogurt. Again, it's a dairy alternative. It's the calcium and the iron that they do need. Remember, we can give foods to replace deficiencies. You know, if a baby had surgery and needs something for healing, we're going to give a little bit more protein, aren't we? If a child is low in calcium or iron, what would we give them? Milk, whole milk, that could help them, or a yogurt, not necessarily soy, something to get them what they need, okay? So using food to help conditions is what we do. Now, immunizations. This is like, oh my God, there's 2 pages of this. What am I going to know? And how do I know what I need to know? Well, hepatitis B, first vaccine given at the hospital. All right. It's usually given within the first 24 hours of birth. And then they'll get the second one when they're 1 or 2 months old. And the third one about 6, 8 to 18 months old. It depends on if they're sick and the other immunizations, et cetera, et cetera. Now, as we go further up, what more do you need to know? Well, when we get to vaccinations, you need to know that 2, 4, 6 months, we give like 4 at every visit, at least 4. And those vastus lataris, the upper outer thigh, where we give these immunizations, it can hurt, okay? They can also run a fever for up to 2 days after immunizations. So remember to give them acetaminophen every 4 to 6 hours as needed, for that pain and for the heat in there. We also can bicycle those legs to get that immunization, the liquid moving around in there, right? And the other thing is, parents are concerned about the pain of the injections. We do have topical anesthetics, and they should be used if a parent is concerned about it. It's better to give the immunizations than not, right? Protects you, me, and everybody else. Another question is influenza vaccine. That is not given till they're 6 months old, and then every year thereafter. And that's the whole big immunization schedule. So pain, toddlers. When does the head circumference and chest circumference become equal in children? Remember in OB, they told you when a baby's born, their head is bigger than their chest. It sort of makes way for the rest of their body, right? Well, about 1.5 years old, the head and the chest should be equal, or the chest should be becoming bigger. And that is what you want to see. Toddlers and nutrition. Now, infants eat whatever, they don't care. I don't think they know how nasty some of the food tastes. Toddlers are starting to understand food and taste and texture, and now we're becoming picky eater. So, as I said, whole milk or that fortified soy, we're going to give that starting about 12 months of age. And that gives this child some nutrition. Again, calcium, potassium, vitamin D, and protein in there for them. Another thing with nutrition and toddlers, because they don't eat that much, remember, roasting vegetable is better than fried. Frying gets rid of the nutritional benefits of it. Another thing is toddlers. They don't want to eat. They are very picky. They sometimes you've got to order a food as a reward. If you eat your, broccoli, you can have a cookie. Okay? Yeah, sometimes we have to bribe these toddlers. Another thing is when we're looking at giving nutrition to any age person, especially when we look at toddlers and they're, really don't want to eat a lot of things, know that many of them can get physiologic anemia, or they become iron deficient anemic because they're not getting the proper nutrition. So in iron deficient anemia, we would do what for that child? We would give them meats, eggs, green vegetables, because that is going to refeed the iron that they do need. Now, a toddler, I think it's the most difficult of all the children to work with. They are the ones that don't trust anybody. Remember, me, mine, I want my mommy, get out of here. Ah! That's a toddler, okay? So, number one, get down. I used to sit even below them, like this picture here. They'd be up on a stretcher. I'd sit on a chair below them, and I would look at them, and we'd just start talking, okay? Just talking about their Batman shirt, how cute it is, or, oh, I love their big eyelashes, whatever. Think of something. Now you are less threatening. Again, you go from least to most intrusive, okay? The best way to examine a child, if that child is on the parent's lap. It's the program I developed for Nicholas Hospital Systems down here, Huggies. It's the acronym H period, U period, G period, etc. Help us give great injections efficiently and safely. Well, it's not just injections. Let's keep a child less fear, less stress, less pain because mommy's hugging them. And now they feel safe. And you could do so many other things with them. So again, when you're working with these children in the mother's lap, get below them from least to most intrusive. And then, of course, toddlers. Is that your heart? Is that your mouth? I mean, make things funny, make things play, and now this kid and you are going to be bestest of friends. Now, a toddler, ages 1 to 3. When they're in pain, when they're sick, when they have a fever, you're going to know. Not necessarily they have these big watery eyes, but they're sitting there, they're sucking their finger, they're not moving, they're not talking, and they don't want to eat. When a toddler doesn't want to eat, doesn't want to play, doesn't want their favorite drink, there's a problem. And that could be telling you what the problem is right there. Let's go investigating. Um, we know that a toddler who hurts is going to cry. They're going to be breath holding and grunting, and depending on where this pain is. So let's evaluate the pain. Toddlers, ages 0 to 3, okay, 0 to 3, let's put it, are the Flack scale. What is the Flack scale? We rate the faces, the legs, the activity, the crying, and consolability. There is a scale, and we use it and add it up, and it gives us a 0 to 10. It will give us one of those scores, okay? From that, we determine, okay, they are in pain. So what can we do? Well, I think when we look at infants, we look at toddlers, distraction is the biggest thing. Give them an iPad, turn on the TV on their favorite TV show. Sometimes they're, can't move and whatever. Turning them, repositioning, rubbing their butts, elevating the head of the bed, bending their knees. What do they need to help them comfortable? Music was always something I had on. I worked night shift for 20 some odd years, and I'd go into all the rooms, put the music radio on every single room, and we would listen to mellow rock all night long. I was happy. The babies slept unbelievable, and the parents actually did like it because the babies looked so comfortable. Remember, hot packs, cold packs, as simple as that can help. And that distraction. Sometimes they're really sick, and especially toddlers, and they don't feel well. I might just start dancing to a song, acting a little bit silly because now they're looking at me, not thinking about themselves. So these are things that we can do for pain on these young children. Remember, when we're giving IM injections, they hurt. If we have an IV, we need to use it. We also can use intranasal. It's just a squirt in the nose. It's better than that shot in the arm or the leg, right? So, but if the only way to give it is through a shot, again, we can use topical anesthetics. We don't want this toddler now becoming, a toddle monster because we hurt them and we scared them. Let's keep it as comfortable and easygoing as possible. Toddlers. Weight gain is slow. Birth weight quadruples at 2.5 years old. That head circumference now is equal to their chest. And we know that nutritionally, they're going to be physiologic anorexia, and know that if we are with a toddler, specifically toddlers, they don't like to eat. I mean, infants, we don't feed them milk before they eat their food. Toddlers, you don't give them snacks before they eat, no juice before they eat. That will stop them from eating the foods that they do need. Know that toddlers are now getting more coordinated. They're throwing things better. As I said, parallel play. Next to each other, me, mine, don't touch. It's mine. And then we're talking about verbal. One words by one, multiple words by ages of 2. And now toddlers are trying to dress themselves inside out, backwards, upside down. They put it on all different ways. The point is they're trying. You got to let them try. Potty training. First of all, before potty training, you need to have 3 signs of readiness, which are they have control of their rectal and urethra. I mean, usually bowel control is before bladder, believe it or not. They can feel the stool, okay? So focus on that first and then go into the bladder, okay? And then, of course, they must have a desire to delay for an immediate reward, right? So, as in, if they have to use the bathroom and they use it, they have to wait till they do something in order to get the reward. That's what that means. Now, toddlers, they explore, they're into everything. And again, having a 2-year-old is like having a blender without a lid on, and turn it on and they're everywhere all at once and you just can't keep up with them. That is a toddler. It is that intense environmental exploration, me, mine. And this is a good time for time outs. Now, timeouts should be 1 minute per year of age. The child needs to be told what they did wrong. They need to sit there and be quiet, and then the clock starts. So a 2-year-old will get a 2-minute timeout. Another thing, toddlers are into everything. They tend to put everything in their mouth, and it could be anything that could be dangerous too. The one thing about the ingestion of any chemical, medicine, anything, they used to tell you to throw up, give Epicac. Oh no, no more, because it could burn and aspirate and cause more problems. The most correct thing to do is immediately call poison control. I've worked very closely with poison control because I worked triage a lot in my last facility that I was at. And I'd call them up. This is a kid. I'd do the assessment, all the numbers, and they would tell me what I needed to do. And then they would call back and follow up. And they have the most up to date information to save that child. So, again, poison control before you drink milk, eat bread, throw up, none of those things. Poison control first. Another thing with toddlers, especially if they're autistic, because remember, they're usually not considered autistic to age 2. That's your toddler, right? One of the things toddlers need is routine. In a hospital, they need to have the same foods, the same bedtime. Bath time is huge. Was it in the morning? Was it at night? Was it in the afternoon? It must be the same. This is what these kids know. You change it, and now they are confused, and now they're frustrated, especially those children that are cognitively delayed, autistic. So preschool children, ages 3 to 5, 3 to 6, 3 to 7, it's all over the place, but it's that middle age before school age. Preschool kids are all about, I fell down and hurt myself because God is punishing me and the blood's coming out and I'm going to die. All the blood's going to come out. So what do? We put a Band-Aid on it and everything's all better, right? I tell you, I just went through my grandson. He's now 9, but oh my goodness, I can't tell you how many different types of Band-Aids I had to have in this house. A little boo-boo, a little piece of blood, cover it up, everything's okay. But they really think they're going to gush out and they're going to bleed to death. Another thing about preschoolers is that Kohlberg thing, right? Remember, earlier kids don't have morality or understanding of right and wrong. Preschoolers do, okay? So, what do preschooler understand? Right and wrong and a punishment or reward, right? So it's punishment and reward. Do something bad, I'm going to be punished. I do something good, I'm going to get some sort of reward or some good praise. Preschoolers are now about 5 pounds a year, about 2 to 3 inches a year. Everything's getting more mature. They are still picky eaters, but a little bit better than they were as a toddler. And again, they can handle stress a little bit better. Now, from 0 to 3 was the Flack scale. Also know that Flack scale is used for nonverbal children. You could have an 18-year-old cerebral palsy that's nonverbal. They're going to use a Flack scale, okay? Now, preschoolers, ages 3 to 6 in that area. Well, this is what we use, the FACES scale. What are the faces? Those are those pretty little pictures that look there. And it's just the most heartening thing where a little 5-year-old will go and point to, number 4 or number 8. And that's what I feel like with these big sad faces. And it just really makes me want to cry because they do not lie. They tell you exactly how they feel, and it works well. Now, preschoolers, they can jump, they can hop, they can skip, walk backwards, ride a bicycle, all of those things. Now, because they're gross or get up and go, go, go motor skills, remember now they're more mobile. They're riding their tricycles and bicycles and training wheels, some of them not, they're off already, but they're riding around. They're riding down sidewalks. There's an increase of motor vehicle injuries for preschool kids. This is the age group I've seen 3 kids ran over by a car backing up out of driveways. One kid did well, One kid needed surgery but ended up okay, and the third child didn't make it. So again, safety, 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 making sure these children know, very supervised when they're out in public around cars and driving around, because they're chasing a ball, they want to get it, or they're riding fast on their tricycle and they want to win, or whatever it is. We really have to be careful with them. By age 6, they should ride a bike, jump a rope, and play hopscotch. Okay. Now, another thing that we need to mention about children, we're just about almost at school age. So the older preschooler, school age children, what they say, and Piaget is like, if you want to keep a child occupied, all right, if a child is occupied, with doing something that challenges them, they're going to be good. As long as they have the ability to solve, whether it's the puzzle or whether they're building something, whatever project you gave them, as long as they can solve it, they won't be frustrated. You want a challenge. These are now your school age, that 6 to 12 area, where you need to keep them entertained but not overwhelmed. Fine motor skills. It is using things, using scissors, drawing in circles. It's buttoning up buttons, right? Building blocks and towers. Now, communicable diseases. One of the big one that you're going to see a lot about is chickenpox, okay? Varicella. Now, children do get the varicella vaccine, uh, but that doesn't mean they're not going to get chickenpox, because many kids that have gotten the vaccine actually still get chickenpox. So, as a nurse, what does that mean to me? Well, chickenpox is airborne. Okay. So any person has the ability to get it just by breathing the air. So making sure that we are protecting ourselves and other children, there's things we need to know. A child with chickenpox will have a fever. They're not going to feel good. And they're going to have a rash, macules and papules at all different stages of healing. Okay. When they're oozy and juicy, they're airborne and they need to stay home from school until they can go back to school when every single lesion is crusty and dry. That means it's not airborne anymore. Okay. Now, another thing that we talk about is influenza. Again, remember, influenza is the immunization for that. We don't give them till they're 6 months old. And we know Hep B is at birth, 2 weeks, and et cetera, et cetera. Now, we talk a little bit about maltreatment, neglect. There are types of physical, educational, emotional. You withhold physical things, food and shelter. Educational, you don't send them to school. And emotional, you're constantly putting them down. And any of this can happen. I've seen some severe cases of child abuse. And it's really difficult as a nurse. I was the triage nurse who introduced them into the ER. Two specific cases that I'll never forget. And the thing is, I had a hard time, but I handled it professionally with the person who brought the child in. And it wasn't in one case that person. In the other case, it was who had committed the abuse. But again, if you're suspecting anything, get the history. If the injuries and the history don't match, suspect. It's better to be safe than sorry, okay? Another thing is, let's say, I've mentioned it earlier, but let's say you have a child who's been attacked, been abused, been raped, any of this, and you're bringing them into the ER for treatment. Remember the parent, remember the person that brought them in. They're suffering too. Okay. So it's family centered care, it's everybody. Nutrition in preschool. Know that preschoolers do eat a little bit better. Now, they need 1,200 to 1,400 calories a day. So it's actually quite a bit there. They need good protein, because what's protein good for? Muscle growth and for wound healing. They need good calcium, 700 to 1,000. What's calcium for? bones and teeth. Also know that if there's problems with nutrition, too much, too little, again, food diary. How many times you want me to say it? Always get your food diary. And know that we can feed certain foods for certain deficiencies. If there is a problem with wound healing, we can give more protein. If there's a problem with calcium, we can give more things like milk or yogurt or eggs or vegetables, et cetera, et cetera. So again, we can replace them with foods, and to be aware of that. School age children. School age children's now is 6 to 12. It's 6 years along, and it starts out with the end of the baby teeth coming in, and at the end, before adolescence, now all the baby teeth are out and all the permanent teeth are in. And it's the beginning of puberty. So it starts out with a child who's still a small child, ages 6, okay? Growth is steady and constant, 2 inches a year, weight doubles in 6 years, and boys or girls are about the same here. Remember that cognitive growth is part of school age children. They're starting to remember that conservation about the big glass, the small glass. They're both 8-ounce glasses. One looks bigger than the other. It's the same. School age kids understand that. Younger kids would pick the big glass because they think it has more in it. That's Piaget thinking. And then Erickson is all about same-sex peers, which is also your Freud too, right? And then school age children love to please. Morality, that's your Kohlberg there. Injury prevention. Remember, all exams have injuries. They all need safety problems, everything of that, okay? So we need to look at that. So injury prevention. Remember, all age children, the biggest cause of injuries is motor vehicle, okay? Another injury prevention is if you have a kid who's all of a sudden showing signs of stress, which could be abdominal pain, which could be acting out, which means just a change in behavior. They're not what they were. And now, oh, my tummy hurts. I need to go home. And, they weren't like that before. Be aware that these children could be in a stressful environment at home, and this increases risk for injuries because they're not in their right mind. They're not thinking good. Water safety is so important. This is your school age. They're good group to teach, okay? We don't want any drownings. Rear vehicle till they're 13. I didn't know that when my kids were 9 and 11. They used to call shotgun for the front seat, right? Booster seat till they're 8. Remember, safety equipment, always important. And then the other thing, ATV vehicles, and I have them right down the street from me. You cannot have them under age of 16 by themselves. They don't think that they're old enough and the mental capacity to handle if any problems were there. Preparing children for procedures, know that it's on their developmental level. A 6-year-old, you're going to say, oh, I'm going to take a camera, take a picture of your insides. An older person, you say, I'm going to take an x-ray, look at the bones. It depends on their age. Prepare them. ADHD is one of the things that school age that we start to see. These children can't finish anything. Distractibility. They start from here to here, they keep going and they never finish anything. Inattentive, hyperactive, impulsive. That is what it is. The thing with school age thing of ADHD, many teachers think that the kid is just a spoiled child and not listening. I've seen that with a good friend of mine, and it's not necessarily that. So a lot of times ADHD comes through your school nurses. They've been sent to the school nurse with their tummy aches and they're not acting right. So we send them to the school nurse. The school nurse will bring in the parent to say, hey, what's going on here, right? And the parent, let them tell you what they've done already. Do not assume that they have done nothing. They could have taken away all their privileges. They're just not listening. And maybe together with the nurse, with the parents, you can build up some sort of plan to help this child because they can't control themselves. Depression, older school age, and adolescence, absolutely normal. What would you see with a child that's depressed? Well, you can see them sad, hopeless, they're gaining weight, losing weight, sleeping too much, not sleeping enough. They don't want to go out of the house. They're talking about death and stuff like that. If you ever hear a child start talking about the want to die and you can see these signs of depression, take it seriously. They will commit suicide. Dental health. Remember, school age children lose all their baby teeth. So losing a tooth is absolutely normal, right? What is a problem is if there's pain in the teeth. That is a cavity and it does need to be treated. And flossing is important, knowing that a 6-year-old doesn't have that dexterity yet quite to do the flossing the way that they should. Chickenpox, I already went over that. So we've got a kid, chickenpox, all that rash is breaking out. Put the N95 mask on you first, protect you, and then get that child in that isolation room. Ray's syndrome is when we give aspirin to a child. Sometimes this aspirin, when we give it, it's after a viral infection like the flu. Okay. And we give them aspirin to lower their fever. Sometimes there's this metabolic problem and they don't, the aspirin works against them and it's a very serious thing. So never, ever, ever do we recommend aspirin for fever, pain, or anything. Week 5, there's one cardiac disease that we give aspirin to. Anything else, no aspirin. So now we're up to adolescence and how to talk to them. Now, the younger kids, we had to win them over, right? And you think they're harder. Well, adolescents can be very difficult too. So I've learned some tricks in order to try to build up rapport. If they have a sports shirt on, I'll mention it. If they're listening to music in their earpods, I'm going to say, hey, what are you listening to? What do you like? If I see a pair of really neat sneakers on, I'll say, hey, I like those. Where did you get them? Those are pretty cool. Or something. Let me break open the ice. Okay. Now, once you get that little bit of communication, then you need to talk to this child, and you can see they're not talking in front of their parents. Get the parents out of their room. You can, and let the child talk to you. Again, be quiet, let them talk, and be non judgmental. I want you to know adolescents sometimes are going to tell you things that your jaw's just going to drop and you go, oh, you did what? Okay. As long as it doesn't hurt themselves or others, you don't have to say anything to those parents. Sometimes that little moment can help them. An example, many times female adolescents come in with urinary tract infections. One of the reasons is due to sexual activity that their parents have no clue that they're engaging in sex. Me just telling them, well, one of the things you can do is urinate immediately after sex. And they say that decreases the amount of urinary tract infections. Have I just helped that little girl, that adolescent? Yes, I have. So again, we're talking sex and out of the room. I've already said that. Vaccines for sexually transmitted infections, the HPV 3-dose series. Remember, male and females, okay? So adolescents now are trying to figure out who they are and their role confusion. What do I want to be, right? They're fighting against mom and dad to do what they want. They're testing boundaries, and that's part of it. Also, they know what they look like. I don't like my hair. I think I'm too fat, too skinny, too tall, too short. I've too much acne, whatever it is. Body image is huge with adolescents, and a negative self-image can cause depression, which could cause suicide. Leading cause of death in adolescence, always motor vehicle. That's it, always number one, followed by suicide and homicide. Nutrition, nutrition, nutrition. You think adolescents eat right? No. Adolescents tend to get the water bottle and get a bar, nutritional bar, run out of the house, take the $5 for lunch, put it in their pocket so they have it for the weekend, right? So they're not eating correctly. Also, adolescents in the very beginning, they gain 20 to 25% of their whole height and weight. They need nutrition for their body, okay? So again, if we're seeing any issues with the weight, too little, too much, 24-hour diary, and then think about things like anorexia and bulimia. Know that absolutely normal for adolescents, especially the younger ones, to go through mood swings, irregular periods, and all those things. It's just absolutely normal. It's part of this growing up. We wish that adolescents would get more sleep. They need it because of the amount of growth that they're doing, but they don't because they're studying, they're texting, talking on the phone, on the computer, playing games, all of this sort of stuff. So they're really not getting enough sleep. And we as nurses should say, hey, you need to get your 8 hours. Depression, suicide, I've already gone over that. Again, take it seriously. Children will commit suicide. We think they don't, but you don't think it's possible, but they do. It could be a death of a parent. It could be a problem in the household. Could have been mother or father committed suicide. And, now that they're getting very depressed. Now, Tanner stages of development. So there was a question on a Hesse about Tanner stages and which stage would you see? Well, when we're looking at the starting of puberty, a female, the first thing you're going to see is a breast bud. That's the first thing you're going to see. It's going to take up to 2 years later for the menarche, for the menstruation. Okay. So, but you're going to see that. So when we look at the scale, number one, they're still kids, no changes. Number two is when we see that breast bud. And then number five is the mature, right? That's the end. So when we're looking at what the answer could be, it will be 3 or 4. You got a 50% chance. Is it now the areola is getting darker, or now we're starting to see the hair going up? What are we seeing? Okay. And again, common for girls to have those irregular cycles, especially they're growing so fast, etc. And they get moody because now all these hormones are coming up. You know how men always say, oh, do you have your period? You're so moody today. Well, it could be part of that hormones. So again, you've got a review here if you need help on dosage calc. If not, I can help you with it. If you need worksheets, I can give them to you. Here's all your Kahoots. They've been all updated here from weeks 1, 2, and 3. I've divided up weeks 2, 3, all the way to the end for each condition, whether it's infants, and the second one's toddler preschool. I would highly recommend you go over that. Is there anything I can do for anybody?